I'm Caroline Hastings. I'm a pediatric hematologist-oncologist at the University of California, San Francisco, Benioff Children's Hospital in Oakland. And I am very involved with Niemann-Pick C disease since, well, it's been about 18 years, in both discovery of new therapeutics as well as clinical care. So NPC is considered a neurodegenerative disorder with also a visceral component. It is a lipid trafficking disorder in which cholesterol is not able to be appropriately transported out of the lysosome, and this is related to a defective NPC1 and or NPC2 protein. And this is autosomal recessively inherited, but the dysfunctional proteins prohibit that movement of cholesterol, which is really important to life-sustaining with respect to integrity of the cellular membranes, but as well as production of other important compounds. And without cholesterol getting to not only the appropriate areas, in addition to the substrate building up in cells, it can lead to dysfunction and death of those cells. And the neurons are particularly sensitive to that, so that's why we tend to see a lot of neurocognitive degeneration. A lot of heterogeneity in the clinical presentation of NPC. So patients may be managed a little differently depending on if they are presenting early in life in infancy versus childhood versus adulthood. There's a whole spectrum of clinical manifestations of the disease. And early in life, we might see liver disease as a predominant manifestation with abnormal liver function and very enlarged liver and or spleen. And in kind of the later infants and grade school children and through adolescence, we tend to see other neurologic manifestations that include problems with ambulation, fine motor control, speech, swallow, but also the propensity to develop seizures or cataplexy, have sleep disturbances, hearing loss. So there are many manifestations. There's also very classically gaze or saccadic dysfunction, gaze palsy and saccadic dysfunction in these patients. Our older patients might present with some of these symptoms, but we also do tend to see more problems with psychiatric diagnoses or even frank psychotic episodes. So the treatment is really focused on providing a lot of supportive care, so there could be treatment for seizures, treatment for psychiatric conditions, treatment for liver dysfunction. But in addition, we're also looking right now for possibilities of very specific NPC disease-modifying agents. So Trappsol Cyclo is hydroxypropyl beta-cyclodextrin, which is a naturally occurring oligosaccharide. It's a sugar compound. And this, we've now, I believe we're about 18 years into this journey of identifying this compound that was previously used as an excipient to make other drugs more soluble and get it to parts of the body that they need to get to, but as well as it was used in cell culture to extract cholesterol. And it was found in early experiments around 2007 in NPC mice that it actually prolongs the life in these mice. And what we have come to learn about the mechanism of action is that it appears to bypass the dysfunctional NPC proteins that can no longer move the cholesterol where it needs to be. And cyclodextrin is able to capture this cholesterol and move it out of the cell into the areas that it needs to be in. We have an oral presentation on the status of the current pivotal phase 3 trial. This is a sub-study though. It's in infants through up to age 3 years of age at the time of enrollment. And all of these patients received intravenous cyclodextrin every 2 weeks. And this is the Trappsol Cyclo cyclodextrin product. We were looking at adverse effects, safety, and tolerability in these patients, and also clinical outcomes assessments. Well, the trial's not done yet, so we haven't been able to gather all the data yet to be able to present the final results So we're going to just be doing an update on safety, which is actually, it appears to be very safe, very well tolerated. Patients have been very compliant with the treatment, and I think they're doing pretty well overall. We're seeing some definite signals that we're having some benefit in patients in the future. So this is a 96-week long trial, so it's long. And in April of this year, all patients, both in the main study and in the sub-study of infants, will have reached at least 48 weeks, and probably about 2/3 of the patients will actually be complete. So the data is going to become more robust pretty quickly. Well, I would say we have 2 posters as well. We do have the main study, as I mentioned, and the main study is for patients ages 3 years of age through adulthood, no ending age. And this clinical trial is testing Trappsol Cyclo IV infusions versus placebo. So it's a 2-to-1 randomization. We have a lot of patients on the study, 94 patients enrolled, which makes it the largest and also the longest trial of a therapeutic in Niemann-Pick C. So again, the trial's not completed yet. All patients haven't come to the end of the trial at this point. But so far, the safety looks excellent. The safety profile just shows that primarily there are mild adverse events, but we haven't had any significant serious adverse events. And patients are very compliant with the treatment as well. We have a very low dropout rate. So overall, the trial's going well, and we're hoping for a good clinical outcome. So early diagnosis is a problem with all rare disease, and NPC included. We now have, I think, a lot more presence on the internet and social media, which helps quite a bit. There are family foundations that put information out. I think that patients, interestingly, are more and more being recognized by either the family members or their primary physicians as something significantly wrong. But typically what I've seen is when patients have a combination of a physical abnormality like ataxia or maybe some problems with fine motor coordination in combination with some cognitive degeneration, doing less well at school and having more difficulty in general with memory, then usually they get referred to subspecialists who start going down the path of lysosomal or other metabolic disorders. But it is definitely being diagnosed earlier, but still that diagnostic odyssey could be many months to years.